Good afternoon, and thank you for joining us. First thing I want to do is reiterate again today what I said Wednesday. If you have not been tested and you have symptoms, get tested. We have the resources available, and equally important, they are free. You don't need a doctor's referral, but you do need to make an appointment. Now, at this time, I want to say, and let me repeat it, we are not testing if you do not have symptoms. You must have symptoms to be tested. We just don't have enough tests available to test everyone. But if you do have symptoms, there's no excuse not to get a test. In fact, we're testing all over the city, and starting today, we're adding more capacity in Fraser and in Hickory Hill. The resources are there and waiting to be used, so please use them. Now, as I've said before, and everyone's noticed, our small businesses, especially our locally owned restaurants, have been hit very hard during this pandemic. Also, we have many more people in Memphis in need of food. So I'm going to announce something today that's going to help in a small way both of these challenges. Today we're launching the Mayor's Meal Challenge to encourage more people to support our restaurants and to help the Mid-South Food Bank. With leftover campaign money from last year, I will pay $25 to the Memphis Food Bank for each photo on my or the city's social media pages showing that you bought takeout food from one of our small, great restaurants in Memphis. $25 to the Mid-South Food Bank for every photo of you buying takeout food. Now, this is limited to 2,500, so I want to get those first 100 photos posted this very weekend. If the need arises, I'll try to raise more money to help. I was inspired with this idea by the mayor of Arlington, Texas, a friend of mine, Jeff Williams, and so we decided to follow suit right here in Memphis with the Mayor's Meal Challenge for our community. To participate in this challenge, you have to pick up a to-go order from a local restaurant, post your photos of the food on social media, and please tag the City of Memphis or me on Facebook or Twitter, and use the hashtags hashtag Mayor's Meal Challenge or hashtag Safer at Home. This is a good and small way that we can all help out the small businesses and the Mid-South Food Bank. Overall, during this critical time, I do encourage everyone to continue to shop local and support our businesses. If you want to make a donation directly to the food bank, visit www.midsouthfoodbank.org. All right, lastly, I want to mention as a test case, we are going to open the links at Whitehaven Golf Course tomorrow under strict guidelines that enforce social distancing. These guidelines have already been approved by the county health department and are being implemented in several suburban golf courses right now. So we're going to try it out at the links at Whitehaven, and if all goes well, we'll try to expand that, because I've been convinced you can play golf and have social distancing at the same time, but we'll see tomorrow. Now, Dr. Lisa Haushalter.
Thank you, Mayor Strickland. Good afternoon, everyone. We'll give our regular daily updates, and then I'm going to end with a few comments that are focused on testing as well. So as of today, we have 1,616 cases. That's an increase of 108 from yesterday. What that demonstrates to us is, again, we're still inclining, but not at the rate that we were initially, so that lets us know that social distancing is working, and really want to express the health department and public health's appreciation for everyone's efforts to continue to social distance. We've had 35 deaths thus far. We are continuing to do a significant amount of testing, but need to get our testing numbers up. To date in Shelby County, we've tested 15,437 individuals, and that's a combination of our healthcare systems as well as our community-based testing and some tests that are done by the health department. And we have, as I've said earlier, 1,616 that are positive, or a 9.5% positivity rate, which has stayed fairly consistent throughout the pandemic here locally. With our deaths at 35, that means we still have a little bit over a 2% positivity rate. We will continue to monitor that closely, as we know as more seniors and individuals with chronic illnesses get infected, the death numbers will continue to go up. Many of you have been interested in the health resource tracking system data, and we're able to report that data at a very high level now. So we're very pleased to say that we're not utilizing all the capacity in our healthcare systems. We're about 67% utilization of our acute care beds, 64% ICU beds, and then for negative pressure rooms, 32%. So significant capacity still remains. In addition to testing, one of the things we know is critically important is isolation and quarantine of individuals who are either infected or who have been exposed to someone who's infected. So of our current 1,616 cases, we know that 1,247 contact investigations have been closed, and we've identified almost 3,000 contacts. And we have over 1,000 individuals currently in quarantine. We've received some inquiries at the health department today because, as with many organizations that have essential workers, we too have had individual employees who have tested positive. So to date, of our 550 employees, we have had 2 individuals who tested positive. All of their co-workers that were close contacts have been quarantined, and then we have another individual who was identified as a contact but is not positive, and that individual is also under quarantine. As with many other organizations, we screen our employees regardless of which facility they are entering, not only for fever but for signs and symptoms of COVID, and whether or not they've been exposed or in contact. And as, again, with other organizations, we do extensive cleaning to reduce the transmission in our workplace. We want to thank our workers who continue to come every day. They are on the front lines of not only analyzing this epidemic, but doing the contact tracing, which is critical to our success moving forward. What I wanted to end with was really what Mayor Strickland started with, is that it's really important that people who need tested get tested. We've been able to expand testing over many weeks, and we look to continue to expand so that there's more options and locations for people to get tested. But anyone who is symptomatic should avail themselves of testing. That's really the most critical element moving forward, is to identify cases and get them isolated. And then at some point in the future, we can move to asymptomatic testing. We've had questions on what are mild symptoms, what are moderate symptoms, and so on. So I actually thought it would be helpful to highlight one of the screening protocols from one of our community providers. So if an individual would call to see about getting tested, they will be asked if they have flu-like symptoms, if they've had a fever, any chills or shaking, shortness of breath, sore throat potentially, muscle aches and pains, an acute loss of smell or taste. And that's one of the things that's very specific to COVID, that one of the early symptoms is people are not able to smell or taste. And people may also have GI symptoms, particularly diarrhea or loss of appetite. Also, we also look to individuals who are most at risk of being exceptionally ill from COVID. So those are people over 65, individuals with diabetes or heart disease, HIV, or individuals who are receiving immunocompromising medications, for example, treatment for cancer. We will also look to test healthcare workers in the future, but healthcare workers currently can be tested through their providers, and we encourage them to do that in partnership with their provider. So I'll end there and open it up for questions.
Sam Hardiman with the Commercial Appeal.
Hi, I have two questions, one for Dr. Haushalter, the other for Mayor Strickland. For Dr. Haushalter, how many of your employees are under quarantine? And then to build on that, what is the difference between a cluster and an outbreak at a nursing home?
Sure. So the number of employees we have under quarantine, don't quote me on this, I'm going to estimate it's about 6. So I know for the first 2 employees that we had that were positive, we identified 4 contacts, and then we have 1 other employee who, as I said, is quarantined for a family contact, not a work-related contact. So it's under 6 total, but I can confirm that and get back to you. A cluster is when there are 2 or more cases associated with an institution and that there's a linkage between those 2 individuals. So an example may be a healthcare worker and 1 resident, or it may be 2 residents and 2 residents plus a healthcare worker. So 2 or more is considered a cluster. We currently have 7 nursing homes that we're working with and 1 group home. And I think your next question was for the mayor, so I'll move out of the way.
Mayor, what is the status of the PPE for both the first responders and local hospitals, and have the shipments that the city has ordered, have they come in, or are there still issues with the supply chain?
As of this morning, everyone was in green, meaning they had enough PPE for now in the foreseeable future. That's the hospitals and the first responders. Many of the shipments have come in, tens of thousands of masks. Not all of them have come in, so it's a continual process where we're all, for the foreseeable future, we're going to have outstanding orders leading us up to the future. But as of this morning, everything's green.
Bradley Broders with Local Memphis 24.
Good afternoon, everyone. My first question is for Mayor Strickland. I didn't know if you had any general comment about President Trump's discussions from the White House level of gradual reopening. I know you and Doug McGowan have been talking about this week. I didn't know if you had any thoughts of that, any updates with that. And Dr. Haushalter, we had a release from one of the nursing facilities confirming more deaths. I didn't know if you had any updates with those, any deaths and any additional symptoms at those 7 assisted living facilities and group homes you had just mentioned. Thank you, everyone.
I have not yet read President Trump's 3-part plan on reopening the economy, but I will say I think everyone's in agreement that it's going to be gradual. We do not know when it's going to take part, but we are working together with the state, with the county health department, the task force, all the city governments in Shelby County, in addition to Nashville, Chattanooga, and Knoxville, all looking at this very issue. So we're got people from the health side and from the business side all advising us. So we do know it's going to be gradual. We don't know when that will start, and we don't know what businesses will be open for business sooner than the others. But I think you'll hear something over the next couple weeks.
In regards to deaths associated with the nursing homes or assisted care facilities, as of late yesterday, we had reports of 6 deaths. 3 were associated with one facility and 3 were associated with another. I can double check to see if we had any reports as of this morning, and Joan can get back to you on those. I don't have any other specific updates on those facilities. I would just say we have 2 strike teams that work closely with facilities, and that would include obviously nursing homes, but it would also include group homes and any work that we may need to do with corrections. We will continue to work closely with those institutions. One of the significant challenges really is PPE. Some of the organizations may not traditionally need the PPE that's needed during the COVID outbreak and pandemic, and so making sure that they have those appropriate PPE is a high priority for us. I will say all of the organizations that we're working with are very cooperative, very committed to their patients, and want to do everything that they can to assure the well-being not only of their patients but also of their employees.
Kendall Downing, WMC 5.
Hey everyone, good afternoon. I had two questions related to testing. The first would be, how many people, what is our total capacity that we can test in the area every day? And how much of that capacity is being used daily on average? And my other question kind of follows along with that about vulnerable populations. I know that today the sheriff told us that there have been inmates that have tested positive at 201 Poplar. And I know that the White House has floated the possibility or the thought of testing people who don't have symptoms in vulnerable populations to get a better gauge of where the virus is. Are we at a point where we would be moving to that, to test people in those vulnerable populations, nursing homes or jails that may not have symptoms? And what does that look like?
So you had a lot of questions there. I think I'm going to try to answer all of them. If I missed something, please let me know. As far as capacity each day, it's actually increasing every day. So we have historically had within our community testing sites a capacity of about 500, but that's increasing. And in most cases, those appointments are full. There may be an occasional day where they're underutilizing appointments, but in general, they're trying to fill those. I really can't speak to our healthcare systems because their way of having people tested is a little bit different. Someone's going to report to their provider or be an inpatient or be in an emergency room, and so they have the ability to test as needed because they do have the supplies. But we can give a more regular update on how much is being available for testing and how much testing is done. For vulnerable populations, our first strategy has been to work with our testing subcommittee, and that subcommittee has identified 3 tiers, and those tiers are prioritized based on the amount of positive cases so far in a given geographic area, social vulnerability, so that gets to those vulnerable populations, as well as whether or not there's existing testing. And we will expand out geographically from Tier 1 to Tier 2 to Tier 3 based on highest priority. When we would move to asymptomatic testing is once we're assured that we're actually getting people tested who are symptomatic and that we have sufficient capacity to expand outward. For other populations, such as let's use nursing homes, for those who have clusters, the health department is working with them to get testing done if needed, both of their residents as well as their staff, and we've continued to do that over several weeks. There have been recommendations to frontline healthcare workers, particularly in nursing homes, to get tested. Many of them can get tested either through their organization or ideally through a healthcare provider, and we're encouraging them to do that. Within correctional facilities, many, if not all, know that the care of those who are incarcerated or detained in Shelby County falls under the health department. So we have been working very closely not only with WellPath, our inmate care provider, but the sheriff as well as Corrections Director Alexander to prevent COVID coming into those systems, and then monitoring for signs and symptoms really early on and getting the most at risk or those who are symptomatic tested. It doesn't mean we wouldn't move to asymptomatic testing, but at the current time we're still prioritizing those who are symptomatic. And then you'll recall that I previously reported out on juveniles that we had quarantined. All of those juveniles were asymptomatic, but we opted to test them because we felt that they were a highly vulnerable population. So we may exercise judgment to test some asymptomatic individuals who are either high risk because of illness or who have been quarantined. And I think I answered most of your questions.
Jackie Massey with Fox 13 Memphis.
2 questions for the mayor. First of all, I briefly touched on reopening, but how will you handle that if the state says, okay, we're going to start to reopen and like other counties are opening on their own, like when will you decide? Like what will you do? Will you be looking at the county first and proceed from there? And also wanted to ask you a little bit about the discussions with the other metro mayors and what type of updates you can tell us about that. I know you've been meeting with Chattanooga mayor as well as the Nashville mayor. What can you tell us about those meetings and what have you gathered from those?
Sure, I'll start with the first question. We do not anticipate that the state is going to get out in front of us and make mandates for Memphis and Shelby County without our input, and that's just not going to happen. We're working side by side with them on the governor's his task force on economic development, economic reopening, and so we think that process will take at least 2 weeks to outline how it's going to reopen and when and those kind of questions. So I do not believe the states or the county is going to get ahead of the city. I think we're all in this together. With respect to your other point, every Sunday for the last 3 or 4 Sundays, I've had a conference call with the mayors of Nashville, Knoxville, and Chattanooga just to bounce ideas off of our team. Our Chief Operating Officer, Doug McGowan, who's attended many of these, he's in constant contact with his counterparts in those cities. Just like Mayor Harris hosts a conference call once a week with all the mayors in Shelby County, all striving to be on the same page. Mayor Harris and I were talking earlier this week, and we said our goal over the next few weeks is that the state of Tennessee, Shelby County, the Shelby County Health Department, City of Memphis, Germantown, Carterville, Arlington, Nashville, Chattanooga, and Knoxville are all on the same page about how this gradual reopening will occur. I'm not promising that we're going to get there, but that is our goal, and I think everyone on the front end has a good faith belief that we can get that done.
Jessica Gertler with WREG.
Hey there. We had heard that Christ Community and Hickory Hill Cherokee Health Center was not testing today as planned. Do you know if that's true and why? And then also talking about these clusters, when we talk about strike teams, how do they work? And do you all have enough personnel as the number of clusters continues to grow?
I'll let Dr. Householder handle maybe both those, but I don't know of the first question, of whether they are closed or open today. I've not heard that they were closed.
Yeah, there's a variety of testing sites open today, so I don't have any updates that there's been any issues with testing, particularly with Christ Community. It's possible with Cherokee, my understanding is they may have delayed their first testing site, which may have been scheduled for today initially. As far as the strike teams and how they work, one of the roles of public health is to do contact investigations for a variety of diseases, anywhere from tuberculosis to HIV to hepatitis A and now COVID-19. So we are experienced at doing contact investigations and tracing those contacts. When we have a cluster, a strike team is a group of professionals that are generally interdisciplinary, so you'll have someone who has clinical background. In some cases, we may have a lab person on that team. We'll have epidemiologists and others who are skilled at investigation to go in and work with that particular organization or work with that cluster. Sometimes clusters are community clusters, not associated with an organization, to do multiple things. One is to overall do an assessment of who's at risk, what are all the contributing factors to ongoing transmission, and what are the appropriate public health actions to take to be able to reduce transmission amongst that cluster. And it takes a variety of different perspectives to make sure that we're not missing any of the opportunities for reducing transmission amongst the cluster. At the current time, we have sufficient staffing. But as this pandemic continues to grow, we're like any other organization. We will reach our capacity and may need assistance. We have had a significant number of volunteers come forward. Many of those are helping us with what's called monitoring, which is not the same as contact tracing. That's keeping up with individuals who are in quarantine and checking in that they're adhering to that quarantine. We also have the ability to expand staffing in other ways. One, we can add temporary staffing. We oftentimes partner with academic institutions, so we're exploring how do we partner with our academic partners to build our capacity if need be. And then we can also call upon the state or other resources across the state to assist our team if our capacity gets exceeded in any way. There's a lot of questions about when do we reopen, how do we loosen the restrictions. And one of the key measures to being able to move forward is public health capacity. So we will be looking very closely at our capacity, sharing that information, and identifying areas for improvement on our end so that we're meeting the needs of everyone in Shelby County.
Jacob Steimer with the Memphis Business Journal.
Yeah, I had a question for Mayor Strickland. Some governments have started layoffs and others have announced broad pay cuts. How likely is it you'll have to use one of those measures in a significant way? And how will you decide, picking between those two? How would you approach that decision?
This coming Tuesday, I'm going to present to the City Council our budget situation. The current budget cycle that we're in, which ends June 30th, we anticipate that there will be significant budget shortfalls. All sales taxes are paid to the state of Tennessee first, and then the state cuts us our check for it. We will not be getting March's payment, which is probably the first month that was affected, until May. So to date, we've not had a shortfall, but we do believe the shortfalls are coming for the last quarter of this year. We also anticipate an even larger budget deficit for next year, and it's mostly related to a significant shortfall in sales taxes. There's other fees involved that will probably go down, but it's really driven by sales taxes. We're not prepared right now to outline how we want to deal with that. We will address some of those ideas first with the City Council on Tuesday.
Bill Dries with the Daily Memphian.
Yes, I have two questions. First, for the mayor, I want to just get your thoughts on reopening or starting to reopen with some measures still in place. Are you convinced that those two elements can coexist peacefully or at least harmoniously? And the second question is more technical. Do you expect or is there currently a lag in test results as you ramp this up, or is that something to expect in the future?
What were the 2 points that in your first question that you wanted me to comment on?
It is your thoughts on starting to reopen things with the social distancing measures still in place. Are you convinced those two elements can coexist peacefully?
That's the challenge. I do believe with the guidance of medical experts like Dr. Haushalter, Dr. Jane, the medical community, the hospitals here, and from Dr. Fauci on down, that we can slowly loosen that faucet that we've tightened at the right time. So the challenge is, what's that right time? And it may be different in New York than Memphis. And then secondly, what industries and what parameters do you put around the reopenings? Whether mask will be required of the personnel working in the establishment, whether you limit capacity. All those things have to be worked out. I do trust the process that we've set up to get to those answers. And like I've done the entire pandemic, I'm going to listen to what the doctor orders. So, I think they have faith that we can do it. Now, what I will also say, I've heard people talk, the medical experts say, if we loosen that faucet too much and you see a big spike in cases, we have to be prepared to tighten it back up. And I think your second question is more for Dr. Haushalter.
Your second question had to do with when we get test results back. Previously, I reported sometimes it was up to 6 to 10 days before a test result came into the health department. Currently, the turnaround time is somewhere between 24 to 48 hours. And what's happened as testing has expanded, the laboratories have become more efficient. The largest lab, AEL, has added different equipment and so on. So actually their throughput has continued to improve as we've expanded testing. It doesn't mean there won't be challenges in the future, but I think there's a really good working relationship with the testing centers and the laboratory, the health department and the laboratory, and the health department locally and the state health department, that if there are backlogs, we try to address those quickly. But currently, we're not experiencing the backlogs that we did several weeks ago.
We have time for one final question. Katie Reardon with WKNO.
Hi, Dr. Haushalter. Question about what your colleague, Mr. Sweat, said yesterday when he talked about he broke down for us the COVID-19 fatalities by exposure, and about 25% of them, it seems, comes from healthcare associates. So what is the takeaway from that? What is that indicative? Is that speaking to the number of deaths that have taken place at nursing homes and other facilities, or is that hospital related? Can you provide some sort of analysis of that breakdown?
Sure, and good afternoon. Really what that looks, from our perspective, what that indicates is that there is association with the healthcare facility. So that can be residents in a long-term care facility. It can be a healthcare worker that has worked in a healthcare facility. I want to remind everyone that healthcare workers really are on the front line, and that's not limited to hospital workers or nursing home workers. That also includes our paramedics and EMTs who are interfacing very frequently with individuals who have COVID. Even if they have PPE and the right PPE, their risk of exposure is higher. They have more frequent contact. They have more frequent contact with people who have a heavy viral load. We will continue to analyze it more, but the linkage really is to the facility or type of facility. But I'm also going to remind people of things that I said early on. It's really critical that we do screening in the workplace, and that people who are exhibiting signs and symptoms of illness are able to stay out of the workplace. We do know early on that some of our early cases, individuals continue to work while exhibiting signs and symptoms of illness, and that is in part because they are so committed to their work and wanted to be present in the workplace. So sick people should stay home. And I'll end with that.
All right, any closing statements? Fantastic. This concludes our briefing. Thank you, everyone. Have a wonderful weekend. Please stay healthy, and we will see you Monday.